So Delaney, let's go ahead and go to the next slide. So folks, this is the agenda. It's pretty straightforward. It's really got two core purposes of the things that we want to talk about and go over this morning. We want to talk about the impact of the expiration of those tax credits, and then 1006, House Bill 1006 that we got through in special session. But my core goals for today, I've got two goals that I'm hoping to leave you with. The first one, and the most important one, is to really encourage you all, and hopefully at the end of this conversation, you're going to feel like the need and the absolute need to reach out to our congressional delegation, to the folks that represent you in your districts, and really push them to extend the enhanced premium tax credits. That's what this conversation is all about this morning, folks, to really explain to you how important those are and the impact of what's going to happen if they actually do expire. And that's the second goal. I really want you all to understand what's coming your way if Congress doesn't act and these enhanced premiums tax credits do expire. To be completely candid with you, it's going to be awful. And you're going to have a lot of really upset constituents in your districts, a lot of really upset people that you take care of and that you represent in one way or another. And I don't want you to be surprised when you start getting the phone calls and the emails. So those are the two core goals. I'm going to do my best, folks, to explain things as we go from the standpoint of just a general everyday person, not somebody that is entrenched in the health policy issues of the day. But if I fail to do that and there's something that doesn't make sense as I'm walking you through all of this, please don't hesitate to jump in here. Raise your hand, throw something into the question box, and I will back up and make sure that I'm explaining things so that they make sense. But let's go to the next slide, Delaney. So the background on the enhanced premium tax credits, let's start there and what they are. So the enhanced premium tax credits, actually taking a step back even further than that. So the ACA, the Affordable Care Act, when it was passed in 2010 and then when it went into effect in 2014, it had kind of what's best to kind of think of as some base level tax credits, base level premium assistance for people that are enrolled in the individual market. So the people that are enrolled in the individual market are people that aren't getting their health coverage from an employer and don't have Medicaid or Medicare coverage. So it's the people that really are buying their own health insurance coverage, and it's really the core purpose of the ACA. So the tax credits that were first kind of a core part of the ACA initially back in 2014 when it first came into being, they were cut off at 400% of the federal poverty level. To give you an idea of what that means today, what 400% of the federal poverty level means today, that's about $62,000 for a single person, all the way up. If it's a family of four, it's about $128,000 in annual income. So we're not talking about a ton of money. And people over that 400% of federal poverty level, they were left on their own to pay full freight for the health insurance coverage. And really, when you think about it, folks, they were the only people in the market that had to pay full freight in our health insurance market across the board, that had to pay full freight for their health insurance coverage. People in Medicaid have obviously substantial subsidies from the federal government and the state. Medicare coverage is there's a lot of help from the federal government on Medicare coverage. And then if you have coverage from your employer is almost most likely paying a substantial portion of your premium too. So it was really those people that were buying their insurance coverage through the Affordable Care Act over that 400% of the federal poverty level that were, for all intents and purposes, left on their own to figure out a way to afford their health insurance coverage. That was referred to as the subsidy cliff back in the day. But then during the pandemic, with the American Rescue Plan Act, Congress extended those subsidies in the Affordable Care Act, and they extended them above 400% of the federal poverty level, and they increased the subsidies below 400% of the federal poverty level as well. So instead of that 400% subsidy cliff, they changed it. And really the core way that they changed the coverage was they set the amount that you had to spend as an individual person or as a family of your annual income at 8.5% of your annual income. So in other words, you would be capped at spending 8.5% of your annual income on your health insurance coverage. Anything above that 8.5%, the federal government subsidized. So it was a huge change, right? It made it so that a whole new group of people could really afford their health insurance coverage and really came into the market as a result of that. But it also meant that people that were enrolled in the market they had a whole new subsidy that helped them afford their health insurance coverage and then allowed them to absorb other costs, obviously, in their budget. So that's where the 225,000 people come into play. So about 225,000 people today, the vast majority of people that are enrolled in the exchange depend on those tax credits, those enhanced tax credits, in order to actually afford their health insurance coverage. At the end of this year, those enhanced premium tax credits are set to go away. So they're set to go away on December 31st, 2025. So starting January 1st, 2026, that subsidy cliff that we talked about, it's about to come roaring back. And we're going to talk about what that means and the practical impact of it. Because candidly, folks, it's terrible. It's going to be incredibly awful for the people in your communities. And that's why we're doing everything we can to get the word out about how bad it's going to be so that we can hopefully urge Congress to act. So let's go to the next slide. So that was the background on the tax credits. But those tax credits, they have very large impacts on other things other than just the core base affordability question that we're talking about. So our reinsurance program. So some of you may be familiar with the reinsurance program that we have in the state. But the reinsurance program really is it was the first tool that we implemented in Colorado to help people that were impacted by that subsidy cliff that I talked about. So people over 400% of the federal poverty level that were left to purchase their health insurance coverage and try and find a way to afford their health insurance coverage on their own. So that was we passed the reinsurance program. Really, the core purpose of it was to help those people. And we reduced premiums every year through the reinsurance program, starting back in 2020, by 20% on average across the state. But very importantly, we've been able to actually decrease premiums through the reinsurance program even more in our rural parts of the state, any place from about 30 to 35% on the western slope, and about the same, maybe 25 to 30% on the eastern plains. But the reinsurance program, as we sit here today, it has two funding sources. We have a fee on insurance companies that they pay, but for every dollar that we get from that fee, we actually get $2 back from the federal government. So the way that the reinsurance program in general works, we're actually, when we reduce premiums, we're also reducing the amount of money that the federal government has to pay on those tax credits that we talked about, right? Because if premiums are coming down, then they don't have to subsidize as much. So through a waiver process, we go to the federal government and we say, hey, we're saving you all money. You shouldn't just pocket that money. You should give it to us because we're the ones that are doing the hard work, and let us reinvest that money into the reinsurance program and decrease premiums even more. So the easiest way to think about it, folks, is that about 2/3 of our funding for the reinsurance program comes from the federal government through that kind of waiver process that I just talked you through, and about 1/3 comes from that fee that we talked about. But because we're going to have less tax credits that Coloradans are receiving in general, and two, because we're going to have fewer people enrolled in the market, we're going to see a substantial decrease in the reinsurance program funding that we're going to receive from the federal government next year. So we're estimating before House Bill 1006 passed, and I'll come back to that, but before House Bill 1006 passed, we were estimating that we were going to lose just over $100 million of federal funding for the program. And that was going to take the reinsurance program down from the 20% average that we talked about, that we've been able to achieve every year of the program, down to 12% next year. So those two things combined, really, we're going to have a dramatic impact on Coloradans. But it's just the tip of the iceberg, folks. The premium increases that I'm about to walk you through are vastly worse than that. So let's go to the next slide. So let's get into that a little bit, and let's put some meat on the bones about what we're really talking about and what we're afraid is about to happen here, folks. So with the loss of the tax credits, the enhanced tax credits, we are estimating, and these numbers were before House Bill 1006 passed, so I'll come back to that too. But they don't improve markedly; they improve at the margins. So we were estimating that we were going to see about 100 to 110,000 people lose access to healthcare coverage. And folks, I want to pause there for a second too, because you're going to hear people talk about it as people dropping their health insurance. Honestly, that rubs me the wrong way for all sorts of different reasons. The people aren't making a conscious choice to drop their health insurance coverage. What's about to happen to them is going to mean that they can't afford their health insurance coverage, right? This isn't going to be a choice that people willingly make. They're going to be forced into a position. They're going to be forced into a corner where they don't have a choice, where they fundamentally don't have a choice because they can't afford what's being presented to them. So really, I think it's incredibly important for folks to realize that this is people losing access to healthcare coverage. It's not them dropping their health insurance, right? That's the wrong way to think about this. This is people that are going to lose access to healthcare coverage, right? And we're talking about someplace, because we got the bill passed, we think it might be closer to 75,000 people, but it's going to be tens of thousands of Coloradans that are going to lose access to healthcare coverage. I said this at an event yesterday, but it's unfortunately, and this isn't just a Colorado problem. This is happening across the country. This is about to be a very good time to be a bankruptcy attorney in this country, which is tragic, folks. And the reason why I say that is because healthcare bankruptcies are about to skyrocket. Right? We think we're going to lose 75,000 people here, or we thought it was going to be closer to 100,000, but now we think it's going to be closer to 75. That's true everywhere, folks. So millions of people are about to lose the access to healthcare coverage. They're still going to get sick. They're still going to go to the doctor. They're still going to go to the hospital, but they're not going to be able to pay their bills. And that's where those bankruptcies are going to come into play. And like I said, it's completely tragic from my vantage point. Going back to the reinsurance program, like we talked about, we're expecting about a 40% cut to the reinsurance program. House Bill 1006 helped us solve for that. And we'll come back to that as we go. But here's the big number that I really want to resonate with you all. We are projecting that we're going to see about 174% net premium increase for the vast majority of people that are enrolled on the exchange. So that 225,000 people that I told you currently have currently have subsidies through the enhanced premiums tax credits, they are on average about to see 174% premium increase. And I want to let that sit there and resonate with folks for a second, because that is going to be something like we talked about that people can't absorb. We are going to lose 100,000, 75 to 100,000 people having access to healthcare coverage because of that, right? And I can't solve for that. We can't solve for that as a state. That's where we need Congress to act. It is incredibly imperative for Congress to act and to step up into this moment. And we're going to talk a little bit more about that as we go. Let's go to the next slide. So I wanted to show you really kind of what this actually means in a dollar and cents kind of way across the state. So what we're showing you here, folks, is this is a family of four right at that 401% federal poverty level. So right at about $128,000 a year is their annual income. And we wanted to show you what the increase in their annual premium is going to be around the state. So these are averages. This is for a silver plan, so kind of a mid-level plan. It's not the top of the line plan. It's not a Cadillac, but it's not a junk car either. So it's a middle of the road plan. It's where it's the most popular plan typically in the market every year. So what we're showing you here, folks, is that on the low end, that family of four, their annual premium starting January 1st of next year, if Congress doesn't act, on the low end is going to jump by $13,000. On the high end, in our rural parts of the state where most of you live and most of you will have your family and friends taken care of, it's going to be closer to $25,000, $26,000. That's what I mean when I tell you this isn't something that people are going to be able to absorb. This isn't something that where we have people that are dropping coverage. We are going to be ripping coverage away from people if Congress doesn't act. That's why I'm so passionate about, especially in this moment right now, how important it is for all of us to be doing anything and everything we can to get to our congressional delegation and really tell them, make sure that they understand what's about to happen, right? And that they have the opportunity to help. They have the opportunity to step up. Congressman Hurd right now, he's got a bill introduced to extend the subsidies by 1 year. Unfortunately, it doesn't sound like the rest of the Republican delegation is quite on board with that, but hopefully if you all reach out to them and tell them how important it is that they act, that hopefully they will get on board. From everything we're hearing, the Democratic delegation is on board with doing whatever we can to help people. So really, this is the story, folks. Right here is about what's about to happen to the people in your communities. Right? This is going to be something that, like we talked about, people can't absorb. And what this is going to fundamentally mean is that there will be people that are in the midst of cancer treatment. There are women that are about to have babies, people are going to lose coverage right in the middle of healthcare services that are incredibly imperative for them in order to just stay alive. right? You're going to start to hear people have conversations about splitting medications, trying to stockpile medications, trying to break medications into different parts so that they can extend the life of the medications going into next year. The stories that are about to come out, the stories, the phone calls, the emails that you all are about to get, that we're about to get in our shop as well, they're going to be tragic if Congress doesn't act. But that's the big F here, right? Congress has the ability to act. Congress has the ability to help people. So please, like I keep begging you, please reach out to them and let them know that this is important. Let's go to the next slide. So I wanted to kind of walk you through what would actually happen if Congress does extend the subsidies, right? And like we hope that they will, right? So this is the premium increase by insurance company in the red bar of what they requested in the original filing that they had back in June, versus what the premium increase would be if we actually got back to the 20% reinsurance program, which we're going to be back to that point, and the enhanced premium tax credits get extended. So, right, we go from what was a requested 28% average premium increase across the state, dropping to closer to a just under 10% premium increase. And to give you just kind of a comparison, folks, the last 2 years, we've had an 8 to 10% premium increase in the individual market. But every one of those years, we've also seen at the same time more people enrolling in healthcare coverage, right? And that's in large part because the subsidies help people absorb those premium increases. So what we know is that in a world where we have something around an 8 to 10% premium increase, which is what we would expect to be the case if the enhanced premium tax credits get extended, the market can absorb that. People can absorb that, right? We don't lose coverage. The market grows. So those really tragic stories that I'm warning you, you're about to hear about and you're about to get, they won't happen, right? So we won't have people that are losing access to healthcare coverage. We won't have people that in the midst of cancer treatment are forced to drop their coverage. We won't have women that are about to have a baby lose their coverage and wonder what in the hell they're going to do because they don't have healthcare coverage anymore. So that's the real world, folks. That's what we can do. That's where we think we will land if the tax credits get extended. And that's why, again, I'm pushing you so hard to hopefully help us get that done. Let's go to the next slide. So wanted to show you all what we're expecting the drop in coverage to be by each geographic rating area. So the geographic rating areas, folks, the Affordable Care Act requires each state to really set geographic rating areas in their state. So we have 9 geographic rating areas in Colorado. Obviously, they're down at the bottom there, Boulder all the way out west, which is essentially the whole western half of the state, with the exception of Grand Junction. But this is the enrollment loss, right? This is the enrollment loss that we expect to see in your communities if Congress doesn't act. So these are your family, these are your friends, these are your neighbors that are going to lose their health care coverage and their access to health care, again, if Congress doesn't act. But as I keep repeating here, folks, Congress can act and Congress can help. So let's go to the next slide. So I wanted to talk a little bit about what it was going to mean, again, in a more of a dollars and cents standpoint of what people were going to be facing if Congress doesn't act. And I'm going to draw your attention really down to that last line because these are going to be the people that I think are the loudest, that you're going to hear from the most. And these are the people that House Bill 1006, from a standpoint of just a premium assistance program, aren't going to really be able to help. So the people down at that 400% of the federal poverty level, they're going to be paying that whole $541 a month. Whereas back in 2025, they weren't paying that $411, folks. They were probably paying something closer to $200 or $300 a month. But that's for an individual person too. So don't lose sight of that family of 4 income, that family of 4 premium increase that we talked about before, right? This is really going to be incredibly tragic for folks. So let's go to the next slide. So again, wanted to give you some flavor of what this was going to mean for people of where they were, or where they are rather today, and where they're heading going forward. So right now, in that, as you can see in that 2025 net annual premium bucket, you can see how much people are paying right now. What for a family of 4, and that no enhanced premium tax credit column, you can see how much money they're going to have to pay next year. These are averages across the state. right? So in the rural areas, people the premiums are more affordable, and in our sorry, or in the urban areas, premiums are more affordable. In our rural areas, they're more expensive. So these are the averages really across the state, but they're stark, folks, right? So we're going to be going for the people at that 200% of the federal poverty level for that family of four. Their premium's about to rise by about $3,000. All right, that's not going to be something that that family can absorb. I'm not going to read off each one of these to you, but you can see how bad this is about to get. And why we're trying to, again, get the message out as loudly as we can. The governor was just in Grand Junction yesterday having a roundtable in Grand Junction to really get the word out to that community to try and keep them at the table and really keep them incentivized to keep pushing to make sure that we could do everything that we can to get these premium tax credits extended. Let's go to the next slide. So I wanted to talk through a little bit about what you have heard, I'm sure what many of you saw in the press, which was when we announced that the insurance companies requested a 28% premium increase versus that 174% number that I'm talking to you and that I'm stressing so much today. Candidly, folks, I wish we had just never announced the 28%. In a normal year, we always announce what the insurance companies request. Because it's the number that drives the conversation. But this isn't a normal year. That 28% number is largely irrelevant. And the reason why I say that is because the 174%, right? That is what people are going to actually feel. Right, it's that 174%. That is the 28% requested increase, but then on top of that, it's also the impact of the loss of the enhanced premium tax credits. Right. So that's why I say that the 28% number is irrelevant, because the 174% number is what people are going to actually have to pay out of their wallet. Right. People aren't going to care that the insurance companies requested a 28%. People aren't going to care. Honestly, I get this question all the time. Why don't you just deny the insurance companies requested increase? Right. Why don't you just tell them that they're not going to get any increase? Folks, it wouldn't matter. Right. From a practical purpose, that would mean that we're going down to about 150% net premium increase just from the loss of subsidies. Right. And on top of that, if I told the insurance companies, hey, you can't have anything in that 28%, you're going to take you all the way down to zero, I guarantee you the insurance companies would leave the state. So we would have two bad outcomes. We would still see huge premium increases, and we would have, at the very least, fewer insurance companies that were even willing to do business in the state. So that's why the whole ball game here, folks, the entire enchilada rests on Congress's shoulders. They have to extend these tax credits. If they don't, we are going to see just terrible, terrible impacts in our communities. Let's go to the next slide. So I wanted to give you some direct line of sight into the premium increases in your communities, and then the loss of enrollment in some of them too. And we have this separately for each county that we can make public and we can make available for you all, and we'll get that up onto our website. But we wanted to give you a few snapshots here. I'm not going to read them out to you folks. You can see them there. It's stark, right? We're talking about anything from a 160% premium increase, net premium increase, all the way up to nearly 350%, folks. And it's going to have huge impacts on your communities and enrollment. And it's not just, I think it's really important to stress here too, that this isn't just, it doesn't stop with just the people that are losing their access to healthcare coverage. Like we talked about, these folks are still going to get sick. They're still going to end up in the hospital. Uncompensated care in our rural hospitals, but everywhere throughout the state, but in our rural hospitals in particular, is about to skyrocket. And our rural hospitals don't have the ability to absorb that, right? They don't have the means of some of our big hospital systems in our urban corridor to absorb uncompensated care costs going up. What I am incredibly fearful of, folks, is that combined between the loss of enrollment in the individual market and the loss of enrollment that we're about to see from people getting kicked off of Medicaid, right? Our rural hospitals are about to be in an incredible amount of pain. And I am extremely worried that we're going to start to see some of them struggle to stay open. So this isn't just an issue for the individuals that are losing coverage. It's going to reverberate through our communities. It's going to reverberate through our state. What I keep saying is that this isn't an issue that any corner of our healthcare ecosystem is going to be able to avoid, right? The pain that is about to come down is going to reverberate everywhere. But again, right, I know I'm repeating myself, folks, but if you worked at the division, you would know that that's what I tend to do. I repeat myself too much. But this doesn't have to happen. I can't stress that enough, right? Congress can act. Congress can keep this pain from happening. So that's why we're here today, and that's why we're trying to get this message out. But it's not going to stop just with those hospitals too, right? The what I worry about, well, obviously I worry about a lot of different things. But one of the things that I worry about is that there are folks out there that are thinking that this is just an individual market problem, or it's just a Medicaid problem, and it's not going to impact them because they have coverage through their employer. But that's where we go back to those hospitals, right, folks? Those hospitals, they're going to do everything they can to stay open. And in order to do that, they're going to demand as strongly as they possibly can that the rest of the health insurance market makes up for the losses that are coming their way. That is going to primarily land on our employers, right? Our employers, starting next year, I think, are about to see their premiums rise substantially because of what's going to happen in the individual market. And then what the hospitals are also worried about what's going to happen from the Medicaid market too, right? The hospitals are going to try and get in front of the losses that are coming their way, and they're going to demand that employers pay for that, right? So that, again, this is why I say this is about to reverberate across the healthcare ecosystem. But we have the opportunity to at least help in the individual market piece. So again, call your congressperson, ask them to act. Let's go to the next slide. So let's get into House Bill 1006 because there is some good news here, folks. And I don't want to leave you just with all bad news. And it doesn't, as I keep saying, it doesn't have to be all bad news. But we very much wanted to get in front of as much as we could get in front of the pain that was coming, and do as much as we could from the state to blunt the pain that is heading our way from the loss of the tax credits if Congress fundamentally doesn't act. So the way we've talked about that, folks, is that we have tools right now in our tool chest to deal with the challenges that are coming our way. Those tools are the reinsurance program. We have a subsidy program at the state level as well. That's tool number 2, and then the Omni Salute program, which is where we provide coverage for undocumented Coloradans and anyone else that can't get tax credits from the federal government that's enrolled in the individual market. So we wanted to invest into those tools, all right? And we wanted to invest into those tools, one, to get the reinsurance program back to the 20% mark. Because again, that's the main tool that we have to help people that are above 400% of the federal poverty level if they lose their subsidies. But we also wanted to really invest substantially into our on-exchange subsidy program, what we refer to as a premium wrap program, folks. And that's just a health policy wonky term for we just want to be able to help get people some state subsidy money to be able to afford the increase in premium that's coming their way. So that's where House Bill 1006 came into play. Right, we went to the legislature. The governor called a special session, called on the legislature to invest into health insurance affordability enterprise, which is where those programs exist, really to try and help people, to do as much as we can for the state to do as much as we can to step up into this moment. I'm going to stress to you, folks, that we're not going to be able to solve it. And that was part of the conversation as we took House Bill 1006 to the legislature. It wasn't, and it is not a full solution for the pain that Congress is about to really put onto the state. But it is the state stepping up, right? It's our legislature stepping up and saying, hey, we've got a fundamental problem. We have a train wreck coming our way. Let's do as much as we can as a state to help. So let's go to the next slide. So that's what we did, folks. We invested $100 million into the health insurance affordability enterprise, about $50 million into the reinsurance program to get us back to that 20% premium impact. We are investing about $45 million into a premium wrap program. We're going to take that premium wrap, so that $45 million takes that premium wrap program up to $75 million total, and the help that we're going to be able to provide to folks. And then we invested into the Omni Salute program as well to get more people enrolled into the Omni Salute program from the cuts that we were going to have to make. So all total, folks, we're taking that 100,000 people that are going to lose healthcare that we're projecting to lose healthcare coverage down to closer to 75,000. That's what I mean when I tell you that we're not going to be able to solve all of the pain that's coming our way. But it is the state stepping up and doing as much as we can. It is just a one-year solution, folks. And I hesitate to even use the word solution because obviously it's not a solution, but it's a one-year Band-Aid. And then we're going to have to go back if Congress doesn't act, right? If Congress sits on their hands and they let all of this pain come down to Coloradans, we're going to have to go back to our state legislature and we're going to have to ask for more. We're going to have to figure out a way to find more funding in order to help people afford their health insurance coverage and really try and get as many people back covered as we possibly can. But we won't be able to do that, folks, until 2027, right? So we're going to be at the legislature in just a few months during the 2026 session. But any help that we are able to get done and across the finish line, that won't actually happen until 2027 if Congress doesn't act, if we have to take steps at the state level. So we are talking about, at the very least, a year of severe pain in our markets. And that's, again, why it's so incredibly important for Congress to act now. So let's go to the next slide. So this is what we just talked about, kind of explaining in a little bit more detail where the 1006 gets us from that 12%, what we were projecting to be a 12% impact, up to a 20% impact. That on-exchange subsidy, so that premium assistance that we're going to be able to help folks with, we're going to be able to provide a subsidy for people under 400% of the federal poverty level. For the first person in a household, $80 PMPM is per person per month, folks. So that an $80 per month subsidy for the first person in the household and $29 for each person after that. Those two things combined are where we're projecting that we're going to keep about 20 to 25,000 people having access to healthcare coverage. It's really those two components. Then the Omni Salute program, we were able to get some more funding into the Omni Salute program, but the real kind of big reason, the main reason that we're going to be able to get up to 6,700 enrollees is because we changed the benefit structure for the Omni Salute program. It used to have, this year, rather, I should say, it has a very, very rich benefit, and we're going to cut those benefits back to make it more affordable for us to be able to provide that coverage. And we think we're going to be able to get up to about 6,700 people enrolled in that program. That, folks, is a cut from where we stand today. We have 12,000 people enrolled in the Omni Salute program today. We're going to have to cut that down by about half, even with the changes that we were able to implement. So let's go to the next slide, and I think we're at questions, folks. So hopefully I laid that out for you all in a way that makes sense, that really describes everything that's about to happen. And why it's so incredibly imperative for us to act now. And I haven't touched on that piece, so I should for a second here. So the reason why I keep saying that it's imperative for us to act now, we need Congress to extend these subsidies this month. We need them to get that done by September 30th. And the reason for that, folks, is that the open enrollment starts on November 1st. So we're right around the corner from the start of open enrollment. In a normal year, we actually would be closing out rates and sending all of that information over to Connect for Health Colorado for them to start getting everything loaded. Because of 1006, folks, we're about to start the whole rate filing process over again. We are in the midst of starting the whole rate filing process over again. But we need Congress to act by the end of September so we have the opportunity to change the rates, work with our insurance companies, and change the rates and account for the fact that we got the tax credits extended. If they don't, folks, we're going to be out of time. We're going to be out of time from just a pure operational standpoint of being able to get it up and running. But then the second component of that, too, right? People are about to find out right now as we're sitting here, fortunately or unfortunately, probably, people don't understand what is about to happen to them. We've really tried to get the message out about how bad this is going to be. That's why we're having this webinar, obviously. But the average person, right, they're out there going about their every day, and the challenges that they have to face every day. And this is something that even if they have heard about, they probably don't really understand. But it's also a problem that's going to be coming down the pike in the future. But they're going to get their premium notices in October. They're going to get their premium notices someplace around the middle of October, towards the end. And I can guarantee you, folks, once people see the increases that are coming their way, they're just going to turn off, right? It won't matter if Congress acts after that. They're still going to lose access to healthcare coverage because they're going to throw their arms up and say this system is broken. I don't understand how in the world I'm supposed to absorb this, and they're just going to sit on the sidelines. So we really, really, really need Congress to act this month, both from an operational but from a practical purpose as well. And they have the opportunity to do that, right? They've got a budget bill that they're currently debating, and that is the perfect vehicle, from my vantage point at least, to attach this to and make sure that we get this done this month. So I threw a lot at you. We've got some time for questions. I think a lot of you either have my phone number or know somebody that has my phone number. So if you're a little bit shy and you don't want to ask your question today, please feel free to reach out to me separately. You can shoot me an email. My email address is obviously right there. I will get back to you as soon as I possibly can. But Jenna, why don't we see what kind of questions we got?
We don't have any questions at the moment. We did have a question come up earlier in the presentation with somebody asking for one of the graphics. We can send all attendees a copy of this slide deck so you have everything. But if there aren't any questions, please feel free, the Q&A box or the raise hand feature. We have a quiet group this morning.
I know it's early, and I know it can be overwhelming too, folks. Right? It's a ton of data. It's a ton of bad news. So, like I said, if it's easier for you to email me, that's fine. Oh, we got a couple of questions coming in.
Yes. One of them is, do you have people available to present at smaller group meetings?
So, whoever asked that, I will come and present at smaller meetings. So this is, I cannot stress you, when I talked to Congressman Hurd, when I talked to Congressman Crank about this, I promised them that I would do absolutely anything and everything I can. I'll come to DC. I'll come to their districts. I'll come to you all. This is the most important thing, maybe, that I will have done in the 8 years that I've been insurance commissioner, but it is for damn sure the most important thing that we got going on right now. So if you need me to come talk with you all, I will do that.
The other question we have is, you'll send the county level data, and yes, we'll send everything that was in the presentation. We also got a really kind thank you in here. So thank you for that. Thank you. Okay, I see a few more questions coming in. Is there a listing of key legislators that we should contact?
Oh, it's really the congressional delegation, folks. Most importantly, not most importantly, they are the only ball game right now. So reach out to your congressional delegation members, your members of Congress. If they don't act, then yeah, we're gonna have a list of I'm gonna need you to contact everybody at the State House too, with whatever our solution is that we've got coming next session. But my hope is my prayer is that we don't have to bring anything next session because Congress has acted. So right now, it is incredibly important for you to reach out to the congressional delegation, have your family and friends reach out to the congressional delegation. If you know where they go to shop at the grocery store, see if you can catch them at the grocery store. Do anything you can to get the message to them.
And then we just have a request for meeting attendance, which we will manage offline via email. So thank you for that request.
I don't know what it is, but I'll be there. Assuming that I have any ability to be there. Okay, folks.
Okay.
I don't want to keep everybody here just staring at my big head. So thank you again very much for spending some time with us today. Really, I know it's a lot to absorb. So if there are questions as you're thinking about things, or if there's somebody that you'd like me to have a conversation with, please don't hesitate to reach out. But thank you again. Everybody have a good rest of your day.